Happy day to all. Welcome to Physiotherapy Competitive Exam Series. Contact details for license exam crash course are given in the description. For which of the following conditions are spinal flexion exercises and spinal mobilization techniques contraindicated as a treatment intervention? A. Degenerative disc disease, B. Osteoporosis, C. L3 disc herniation, D. Spinal stenosis. The answer is osteoporosis. Due to increased risk of fractures associated with osteoporosis and increased pressures on vertebral bodies with spinal flexion, flexion-based exercises and mobilization techniques are not appropriate in case of osteoporosis. Which component of non-contractile tissue provides the greatest tensile strength to soft tissues? A. Reticulin, B. Elastin, C. Collagen, D. Fascia. C. Collagen is the right answer. Collagen provides tensile strength to the tissue and does not allow for much tissue lengthening without injury to the tissue. Which principle of exercise accounts for the fact that strengthening biceps brachii does not necessarily improve the shoulder flexion? A. Mode of exercise, B. Principle of reversibility, C. Overload principle, D. Specificity of exercise principle. The correct answer is D. Specificity of exercise principle. This principle explains that muscle adaptation to exercise are specific to particular exercises that are performed. If you are strengthening biceps brachii, it is for the elbow flexion primarily. The primary flexor of the shoulder, being the deltoid, will not be strengthened because of biceps curl. So that is to be understood. A patient has lumbar spinal stenosis encroaching the spinal cord. Which of the following he should avoid? A. Rowing, B. Bicycling, C. Tai Chi, D. All of these can be performed. The correct answer is D. All of these can be performed, provided the patient should not do extension. In lumbar spinal stenosis, it is important that extension should be completely avoided. Hope this video would have been informative. For more MCQ series, stay tuned to our channel PhysioCBE.